Yeah, yeah. Yeah, I think it is everything.
I'm sorry, I wasn't aware about how they were doing it, so I went help them set up, and I didn't know. I just had
That's how I got it on here.
yeah, no, I have a report. Like tech savvy, just not
Okay, because I am not.
but we have people who are. That would not know. I had to cross my mind. I didn't figure out what I wanted to do.
Oh,
That's how I brought hers up.
okay.
She said
So are we sending it to you? Brian sending it to you?
Yeah, do you guys want to? Well, how long?
5 minutes?
5-minute break.
Yeah, because I literally you got to come right back though. If you have to go, if you don't have to go, stay seated. So I think while they're waiting for some of these things, there's probably a couple things that we could make sure that we don't that does everybody know that you get life insurance? Yeah.
I got life insurance.
Right? You want life insurance, right? That's one.
That's why you got
at no cost to you.
Yeah,
For
that's why it
anyone
doesn't cost
scheduled
you
or working
anything.
more than 24 hours a week.
I always say it's the benefit no one wants to use, but it's there. We have actually had people who have used it. And, yeah, so unfortunately.
They don't take much out from me. They take like.
In addition to that, there's also long-term disability available for all employees, 35 or more hours a week.
Yeah, and they take it out.
And in your roles,
over time.
you know that they can be hazardous, so that type of benefit can be very valuable and at a cost.
I know, I personally am really excited to hear this presentation because this new healthcare option that is being offered is really kind of revolutionary in our county. All right, and if you happen to opt for this, it's called the MERP. If you happen to opt for this, it makes it so that you're not going to have any co-pays or deductibles because it's a wraparound kind of stuff. She's going to explain it much better than me. But that's why I am really interested in hearing this because I don't know how many of you have medical, a lot of medical expenses, but to not have to worry about that and know that everything's going to be coming out with zero out of pocket.
Take everybody out.
And those of you who do the flex spending plan, that'll be something you have to think about too, because now you won't have to put money aside for your deductibles because they're already going to be part of the insurance plan should you choose that. So I know I personally am like super excited about it. And we're getting a new concierge medicine too. And we're changing companies. The company, how many of you guys have used concierge medicine in the last like 2 months and it hasn't been the same? Right? Not the same. I had to use them like 3 weeks ago where you call the virtual medicine people and I was like, what has gone on here? Because I love our old people. So they were bought out and now, so we're going with a different company. And the cool thing about it is it's also going to give us an opportunity for mental health. So, there's a mental health component with it, right? So these are things that are, obviously she's going to talk more in depth. I'm not, but as I've been hearing about these options, I feel it's so exciting for our staff because there are options that I know that many people are going to be able to utilize.
Oh, here it is.
Here it comes.
Got it? Jeez.
That's it. There we go.
And I'm sorry for you guys. She's probably doing a lot of fast talking too. We're trying to get all the information in. Okay.
Okay, you got it. Now you
Yeah,
get into the teams meeting. Okay.
And everybody, this is Sandy. She's our broker from,
Obviously, I'm not texting.
yeah, and I'm not texting her either. But she's really worked hard to get us this, so please, Gallagher works on our behalf to get the best we can get for our employees. So, they've really worked very hard to get these things. So please just give them your attention as we go through this. I think it'll be interesting to hear what we got available this year.
Is this one here? Okay. I'm trying to see what's here, but I really want to do this.
Yeah, I was just gonna say, do you want me to your new thing on it? Okay.
Okay. All right, guys, sorry about the technical difficulties there. Like they said, I'm Sandy Dembeston. I'm with Gallagher. I'm here today to go through and give you an overview of all of your benefits. I'm going to start with some open enrollment reminders, and we're going to go through the new medical plan that Cheryl mentioned, the new concierge service, the new carrier for that, as well as what a MERP is. We're going to talk a lot about that. Now we're echoing. And then we'll go through how to enroll and waive in the plan. We are going to have a guest, hopefully, from Nonstop, come into the meeting to talk about the MERP some more as well. So just for open enrollment, this is the time of the year where you actually can make changes to your elections for 2025. So for this year, you can switch from one plan to another plan. You can add dependents, you can take dependents off. I want to mention that I'm here for you to answer your questions. So as I'm talking, if you have questions, interrupt me, raise your hand, do whatever you can do, jump up and down, and I'll get your questions answered for you. If you think it's something afterwards, you can always go to the HR team. They know how to get a hold of me. Again, we'll get your questions answered for you, because you need to make a decision on what's best for you and your family, right? So I did want to mention Megan. She's going to be here on Thursday. She's the client manager also for helping Celebrate Abilities. Megan is the person that helps Stephanie and Brian and Teresa when they have questions. But if you have questions, if there's something you don't want to bring directly to HR and you want to bring to Megan, she can help you as well. So I want to make you aware of that. When you make an election for January 1st, it is a pre-tax deduction, which means the IRS does not allow you to make changes to that deduction throughout the year unless you have a qualifying event. The insurance carriers also do not allow you to make changes unless you have a qualifying event. So a qualifying event are things like you get married, you get divorced, you have a reduction in hours, you have a baby, you adopt a child. Maybe you're covered under your spouse's plan, so you waive the coverage here through HCA, and then you need to get into it because they lose coverage. That's a qualifying event. You need to notify HR within 30 days of that. I also want to mention if you're working and you're over the age of 65 and you're eligible for Medicare, that there is a consultant. This presentation will be posted on the UKG website, so you'll be able to get in. You'll be able to see the phone number. It's kind of blocked by the screen sharing thing there, but there's a phone number and an email of someone that can help answer questions about Medicare. If your parents are asking you a lot of questions about Medicare, he can help them as well. It's just an additional service that we can provide to the employees here at HCA. Okay, so overview. Through those in detail. Your dental insurance is not changing. You're still going to have a health savings account. Your vision insurance is staying the same. And new for 2025, we are going with a new carrier for your life and disability insurance. It's going to be through Lincoln Financial. If you're not in the life insurance today and it's something you think you want to do, this is the time you want to do it at open enrollment. You can buy as little as $10,000 in life insurance. without having to answer medical questions, but you can buy as much as 200,000 without having to answer medical questions. So it's an opportunity for you to get life insurance if you
But
cannot
everybody,
get it.
but people get it anyway through HCA if you don't want to, so it's important, that- right?
Yep,
group
we're gonna go through that. Yep, so what you see up here are your company paid benefits. So you have Lincoln Financial, which I was just mentioning. The company provides you with life insurance that's equal to 2 times your annual pay to a maximum benefit of $200,000. That is something you automatically get. As Cheryl mentioned, if you work 20 hours or more a week, the company provides you with that life insurance to protect you and your family. It also has accidental death and dismemberment. So if you die as a direct result of an accident, you'll get your beneficiary will get double that amount. So whatever you make on an annual basis, they'll get 2 times that amount in life insurance. And the company also provides you with long-term disability. This is the group from years and years ago that I talked to. I used to ask a question. I used to say, what is your most valuable asset? And one of your coworkers gave me the funniest answer I've ever had. So I don't ask anymore. I just tell you what your most valuable asset is, and it is your ability to earn an income. If you want to ask me at the end of this what the answer was, I'm more than happy to share, but it was pretty funny. So long-term disability is protecting your ability to earn an income, and HCA recognizes that. They give you protection. 60% of your pre-disability earnings to a maximum of $3,000 a week. And then they also provide virtual concierge service to anyone enrolled in the medical insurance. If you're not enrolled in the medical insurance, you can buy into that for a very low payroll deduction as well. And we'll talk a little bit more about what those benefits are. All right. 2 plan options for medical insurance, 2 plan options for dental insurance, 2 plan options for vision insurance, voluntary benefits, and then as well as your flexible spending account and health savings account. I'm going to go through these in more detail for you. Okay, so the first thing that you're going to see, because that's a question everyone always asks, is what are my payroll deductions? You have a high deductible health plan where you're responsible for the deductible. For a single employee, the payroll deduction is $40.62. And then you're going to have the option to buy into a plan that covers your out-of-pocket expenses 100%. No co-pays, no deductibles, no prescription drug co-pays, $143.08 a payroll. So that is extremely competitive for a plan that has no out-of-pocket expenses. So you'll have the choice between those 2 plans. And HCA has also increased the contribution to family coverage as well. So you'll notice that 2-person and family, that payroll deduction has also gone down. And again, your whole family would have that benefit. So let's just talk about the plans themselves. So like I said, you have 2 plans, and I'm going to ask questions after this, but I want to go through this right here. So you have your current high deductible health plan, which is a $6,350 deductible on an individual and $12,700 on a family. If you spend that, if you reach your deductible, then Excellus starts to pick everything up at 100%. Everything goes towards that deductible. Your medical visits, your office visits, your prescription drugs, unless it's a preventative drug. If it's a preventative drug, it does not go towards the deductible, but you pay a copay. If you go out of network means the doctor does not take Blue Cross Blue Shield anywhere in the country. They're just not a participating provider. Excellus still has some coverage for that, but it's subject to a deductible and co-insurance. The deductible is much higher. It's $12,700 for an individual and $25,400 for a family. Okay, so that's only if you go out of network. Okay, that's plan one, that was that $40 payroll deduction plan. The second plan is the same plan, but we're only taking a company called Nonstop Health, which is a MERP. A MERP is a medical expense reimbursement plan. That medical expense reimbursement plan wraps around this stuff right here. It wraps right around it and it says, okay, if it's subject to the deductible, the $63.50, Nonstop Health is covering it in full. The way they're doing that is they're sending you a Visa card. If you're enrolled in single coverage, that Visa card is going to have $6,350 on it. And if you're enrolled in family coverage, that Visa card is going to have $12,700 on it. The card's only going to work at a medical provider or a pharmacy. You're not going to be able to use it to buy a flat screen TV, okay? But if you go to the ER and you're not admitted, you'll have a $100 copay that you'll pay directly to Nonstop, okay? Other than that, all the same things go towards deductible, but in the second plan, which was that $140 versus $40 in a payroll deduction, everything's covered 100%. If you're having a tough time paying for your prescriptions, it's gonna cover your prescriptions in full, okay? You don't have to avoid going to the doctor because you're worried about having a bill afterwards. You have that debit card to pay for it, okay? That plan is replacing the hybrid plan that you had before and the PPO plan that you had before. So that's a platinum level, no copay plan, okay? It still has out-of-network coverage because it's going to mirror this out-of-network benefit. If you go out-of-network, then you're responsible for the deductible, okay? Your Nonstop's not gonna cover out-of-network. It's only gonna cover all of your in-network services. Any questions on that?
So with that said, it's a Blue Cross Blue Shield plan, and for the most part, it's very widely accepted.
Yes, it's the same base plan. Any Blue Cross Blue Shield provider anywhere in the country, same prescription drug formulary. The only difference is you're getting a Visa card to pay for your out-of-pocket expenses. Okay? And we have Savannah on the call. I just want to make sure before I'm going to get to that in a few minutes, but I just want to, before I get to that.
Is there anybody, while they're working on that, has anybody here ever heard of this before, this option? Does it sound good to people?
Oh, it's not Savannah, it's Kathleen, I'm sorry.
It sounds right.
Kathleen is on the
I
call.
mean, as I'm getting older, I'm like,
All right,
what? Definitely.
Okay. Let's just go back to that other slide. Okay. Yeah, so just so you guys know, just a review of how a high deductible health plan works. You get a card, you get your insurance card. Let me see, I'll get my little props out if I can find my insurance card. Oh, I can't find it. Anyway, we'll pretend I'll do this card. Okay, so you go to the doctor's office, you show them your Excelis Blue Cross Blue Shield card. Okay, they're gonna see you're in a high deductible plan. They should not collect anything from you up front. If they insist on collecting, you can use your Nonstop Visa card, but if you can avoid paying for an upfront when you're in a high deductible, just tell them I have a high deductible, submit the claim to Excelis. Excelis will process the claim. They will apply their network deductible. Okay, so it's almost like wholesale versus retail. Excelis negotiates a price with that doctor. The claim goes through, and then an explanation of benefits goes to the doctor's office and to you at the same time. If you have Nonstop, you're going to use your Nonstop Visa card to pay for that visit when you get the bill. If you don't have Nonstop and you decided to take the plan that's just a high deductible and you get a bill, you just pay that bill. But you always want to you, you always want to match up that explanation of benefits with the bill that you get from the doctor. You're also going to want to save your explanation of benefits and your pharmacy bag receipt in case you get asked to substantiate what you swiped that card for, because that can happen. Prescription drug is real time. When you go to the pharmacy, the pharmacist can see right away what that drug costs, what's going to be applied to your deductible. If you're in the plan with the nonstop Merck, you swipe your nonstop Visa card. If you're not in that plan, then you use your health savings account or you just pay out of pocket. Okay. All right. I'm just going to talk about Ally Health before we go to the nonstop person that's going to go through and give you a little bit more detail than I just did. So you have a new service. It's going from United Concierge Medicine to Ally for Virtual Health. It has not only urgent care that can treat you for things like sore throat, cold, flu, sinus infection, bronchitis, skin rash, okay? You have all that same thing that you had before. You also are getting virtual primary care, which includes lab work once a year, which does not go towards your deductible. Okay, so it's all covered 100%. So you can, if you can't get in to see a primary care physician, you can do virtual primary care and work with a virtual primary care doctor. Very important, especially for those of you that are paying for your deductible yourself. Virtual psychology and psychiatry. UCM did not have that. The psychiatry is up to 10 visits a year that you can go in and either see a psychologist or a psychiatrist on a virtual basis. Okay, another new benefit that the company is providing for you. HCA is paying for this service for you if you're enrolled in the medical plan. If you're not enrolled in the medical plan, I think it's like, what, $4 or something? $4.38 a pay period to pick up this benefit. This covers everyone in your household. When you sign up for Ally, you can go in. I actually used it. I got rid of UCM myself and I went to Ally. I used it a few weeks back. I'm laughing because I wasn't feeling good. I was heating up a cup of hot water to make tea. I set my microwave on 1 minute, 20 seconds, and I was online saying I want to talk to a doctor. Before my water was hot, the doctor called me back. I had a call like instantly from Ally, and they called in a couple scripts. I didn't have to go to the doctor. The other thing, one of my coworkers used the prescription savings program. Again, really big if you're in the plan without nonstop and you have that high deductible that you're responsible for. Your prescription savings, she had to take her dog to the vet and the dog needed medication. She was paying $55 at the pharmacy for the medication. She used the prescription drug saver. She got it for $12. So that's another benefit that you didn't have before with United Concierge Medicine. They'll also help if you get a bill, like whether it's a dental bill or a vision bill or even a medical bill that you're not sure like why it's not covered, or it's like maybe it is your responsibility because you did go out of network, they'll negotiate on your behalf with the provider. So they have a bill saving program as well, right? So again, if you have the health insurance, it is free to you, the service, use it. Even if you have the nonstop coverage, use it. It's easy, it's convenient. You have questions?
Yes, can you define who is in your household?
Yes, it can be elderly parents living with you. It can be a spouse, a domestic partner, a girlfriend, a boyfriend, kids, whoever lives in your household, that's their address, can use this service. Okay, so even if you are signed up as single, your whole family and everyone living in your household gets this service.
So where are they listed, that they know who's in?
You go online and you put them, you sign them up,
Okay,
okay? So you want to list your dependents. And then they'll each get an email. It'll ask them, you know, to list out their medications so the doctor know what medications you're on when you're actually speaking to them. All right. Now we can have Kathleen. I kept saying Devonna, but Kathleen is actually the one that had the today. Okay.
Hi, everyone. Hi. Good morning. Can you hear me?
We can hear you, and I'll run the slides from my end.
Okay, sounds good. Sounds good. All right. Well, good morning, everyone. It's so nice to be here with you today. I don't know if you guys can see me. I do have my camera on. I'm not sure if you can see me or not, but if not, that's okay.
We can't.
Oh, okay.
That's on
Yeah,
us.
right.
Sorry.
Sorry.
Okay, I'll turn it off. No problem. No problem. Well, good morning, everyone. It is so nice to be here with you all today. My name is Kathleen Callahan. I work over here at Nonstop. And today I'm going to walk you through how the Nonstop Health Program works. So the first thing I'm going to do, if you go to the next slide, is just to let you know what we are. So Nonstop Health is what's called a medical expense reimbursement program. It's a long phrase, but the short name for that is a MERP. And it's a program that's run through the IRS, right? It's similar to an HSA, FSA, HRA, things like that. It's that kind of a program. But I do just want to let you know that we are not an HSA or FSA. So people will get us a little bit confused with those because they look and feel very similar. But what I want you to know before we get started is that, again, Nonstop Health is what's called a MERP. And what that means simply is that we cover things differently than like an HSA or FSA would. So I'm going to talk more about that as we go, but I do just want to let you know that there. All right, next slide, please. Okay, so when you enroll in your benefits with Blue Cross Blue Shield, you're going to be automatically enrolled in Nonstop Health as well. So you don't have to do a separate enrollment. They go hand in hand. Even though we are not part of Blue Cross Blue Shield, they do run in tandem with each other. And so when you enroll in those medical benefits, you're going to get 2 Nonstop Visa cards in the mail. They're going to look very similar to the one on the screen, although the logo on the real card is like a silver or gray color. And those cards are going to come in an envelope that look exactly like the one on the screen, that gray envelope right there. So don't throw it out when you get that. Open it, and then when you get those cards, you're going to go ahead and activate them. Now, both of those cards are going to be in your name, the employee's name. However, if you have a dependent, let's just say a spouse, who's going to be on your Blue Cross Blue Shield plan with you, then you can give that second Nonstop Visa card to them and they can sign their name on the back and use it as if it's theirs. And then let's say you have a third dependent. Maybe you have a spouse and then a child who lives away from home and who also needs a Visa card. You can call us. We'll order you another set of Visa cards free of charge. So then you'll have 4. You can distribute them out to your dependents as needed. They work like a debit card. So anytime someone in the family swipes the Visa card to pay for a medical service or prescription, the money will be deducted from your account. Now, also inside with those cards is a handout called Important Information to Read Before Using Your Visa Card. I do really recommend that you read that thoroughly. And if you do have dependents who are going to be using the Visa card, make sure that they also read that. We want everybody who's going to be using the Visa cards to know how to use them and what they can and can't be used for. And then again, just make sure you activate those cards when you get them. Now, last thing on this slide before I go on, your coverage with Nonstop Health begins on January 1st. So you can use the Nonstop Visa card for any expenses that are incurred on or after January 1st. So what this means is you might have your card like December 28th, let's say. You've got it, you've activated it, you're ready to go. But if you get a bill for a service you got in like December or November, you cannot pay that bill with this Visa card because that service happened before you started on the program. So just keep that in mind. You can use the card for things that happen on or after January 1st. Okay, next slide, please. So now you know you're going to get these Visa cards. You're going to activate them. You're going to be good to go with them. And so now I'm going to talk to you about what's going to be on those cards. So you'll see on the screen, here is your Blue Cross Blue Shield deductible and out-of-pocket maximum. And then you'll see that NSH coverage column. And you'll see that mirrors exactly what your out-of-pocket maximum is, because that means that your employer has funded the Visa card up to your full out-of-pocket maximum. So that's a really wonderful and rich benefit that they're providing to you, because what this means is this. Anytime that you or someone in your family goes to the doctor or picks up a prescription or has a hospital visit or anything like that, when you go to pay that bill, as long as you're seeing an in-network provider and that service or prescription is covered under your plan, when you get that bill or you're picking up that prescription, instead of pulling out your personal credit or debit card, you're going to pull out this Visa card and you're going to use that to pay that bill or for that prescription. So you should not, for in-network and covered medical expenses for the year, you should not have to pay anything out of your own pocket. This program will cover that. So this is an incredibly rich benefit that's being provided to you. Now, the one exception to this is a $100 nonstop health emergency room copay. What this means is if you go to the emergency room, you're gonna pay $100 of that bill out of your own pocket, and the rest of it you can pay with your nonstop Visa card. Now, if you're admitted to the hospital, so you're moved from the emergency room to the hospital wing of that building, then that copay is waived because that becomes a hospital visit. Okay, next slide, please. All right, so you have your Visa cards. You know how much money is on them. You've activated them. You're ready to go. So here's the things that how you're going to use the Visa card when you go to the doctor or pharmacy. So the very first thing you want to do, and I'm going to talk more about this on the next slide, but the very, very first thing you want to do is just confirm that the provider you're seeing or the facility you're going to is in network for your Blue Cross Blue Shield plan. Nonstop Health should only be used to pay for in-network providers and facilities. And then the second thing you want to do is make sure that service or prescription is covered under your Blue Cross Blue Shield plan. That's like our second golden rule. Everything has to be covered under your medical plan. When we say covered, we mean that the cost for that visit or that prescription is applied towards your Blue Cross Blue Shield deductible and out-of-pocket maximum. Basically, you're getting credit with Blue Cross Blue Shield for what you're spending that day. So that's your first step. Contact Blue Cross Blue Shield. You can email them, you can call them, you can go onto your online portal. Just confirm that providers in network and that service or prescription is covered. Then, when you go to the doctor or the pharmacy, just make sure they have your correct Blue Cross Blue Shield information on file. You're most likely going to be queued to do that anyway, but if not, just confirm they have your correct Blue number and VIN number for prescriptions and all of that good stuff. That's because we want the provider or the pharmacy to apply everything towards your Blue Cross Blue Shield plan, right? From step number one, we want you to get that credit with Blue Cross Blue Shield. The last step then is when you're asked for money for your prescription or you get a bill in the mail, you're going to go ahead and swipe your Visa card just like any other debit or credit card to pay for that. So really is this simple. First step, make sure everything is covered in the network. Second step, make sure that provider or pharmacy has your correct Blue Cross Blue Shield information on file. Third step, pay for any bills with your nonstop Visa card. And then what will happen is when you hit your out-of-pocket maximum with Blue Cross Blue Shield, you should be out of money on your Visa card at the same time because that's when Blue Cross Blue Shield will begin paying at 100%. Okay, next slide, please. All right, so I know I've said this before, but I am going to repeat it. Our two golden rules for using Nonstop Health. All services and prescriptions have to be covered under that medical plan, and all providers have to be in network. Now, the reason I bring that up on this slide is this. The Nonstop Visa card only works for medical services and prescriptions. So you cannot use it to go buy groceries or a plane ticket or anything like that. It will decline if it's trying to go through for anything but what's something that's coded as a medical expense, which is a beautiful stopgap. But it cannot tell the difference between an in-network or out-of-network provider or a service or prescription that is or is not covered under your Blue Cross Blue Shield plan. So cards like this just cannot get that granular. So that's why we say it really is your responsibility to make sure everything is covered in a network, before you pay for anything with your Visa card. And I'm gonna talk in a minute about why that's so important, but I really do just wanna make sure you guys understand these 2 golden rules. As long as you follow these, the program is really easy to use. Okay, next slide, please. Real quick, I do just want to let you know, if you don't have your card for some reason, so let's say it got lost in the mail on its way to you, or it's 6 months down the line and you've lost it and you're waiting for a new one to arrive. And let's say while you don't have your card, you need to pay a bill or you need to pick up a prescription. We have workarounds in place. So your card should be getting to you by or before January 1. But if you don't have your card for some reason, when the program starts, or again, further down the line, you've lost it and you're waiting for a new one, we do have workarounds in place to help you pay for things, even without the Visa card. So if that happens, just call or email us and let us know, and we'll walk you through your options. Okay, next slide, please. All right, so we get asked a lot, can you just give me a list of what is and isn't covered? Because then I just know, and it makes my life easier. And we totally get that. That would make your life a lot easier if we had a list. However, we don't determine, Nonstop does not determine what is or is not covered under your plan or who is and isn't network. That's Blue Cross Blue Shield's job. So we just simply follow their lead of what they say is covered or in network. So if you are looking for a list, your summary of benefits and coverage from Blue Cross Blue Shield is a great place to start, as is the formulary or drug list from them. But again, you can always call or email Blue Cross Blue Shield and they can let you know if something is covered or in network. But Nonstop is not able to tell you that. However, what we can tell you is there are things that are just very rarely, if ever, going to be covered under a medical plan. So I am just going to give you a heads up on those things. So the first one is routine dental or vision. Those are covered under dental or vision plans. So we're talking about things like that. Those are not covered under medical plans typically. So you wouldn't be able to use Nonstop. And in fact, the card will decline if you try to. Over-the-counter drugs, including that's not going to be covered under Nonstop unless it's something like reconstructive surgery, obviously as part of like a cancer treatment or something that's different. Plus drugs. We get asked a lot, are weight loss drugs going to be covered under Nonstop Health? And again, we follow Blue Cross Blue Shield's lead. So if they say they'll be covered, then you can use Nonstop for them. However, I want to draw your attention to this. A lot of those drugs that are being prescribed right now, Wegovy, Ozempic, things like that, the FDA has not approved those for weight loss. They've approved them for diabetes management and other things like that, but not for weight loss. So a lot of carriers are not covering them for weight loss. They are covering them for diabetes management. So if the prescription is written for that, then most likely Blue Cross Blue Shield will cover it. But if the prescription is written specifically for weight loss, there's a very good chance they're not going to cover it for you. So that's why I really want to call your attention to this. Your doctor does not know what is and is not covered under your medical plan. They're making the best choice that they think is going to work for you, but it's still your responsibility to contact Blue Cross Blue Shield or simply ask your pharmacist if a prescription is covered before you pay for it. That's just good practice, okay? All right, these are just examples. So again, if you're wondering, just call Blue Cross Blue Shield and ask them. Now, discount or coupon programs, GoodRx, Single Care, typically these don't work with Blue Cross Blue Shield or any medical plan. So you would, if you get offered this at the pharmacy, you would kind of either choose to do the discount program and not pay with Nonstop Health, or skip the discount program and pay with Nonstop Health and have everything applied towards your Blue Cross Blue Shield plan. However, I did notice earlier, you guys do have that Ally program that does have a discount program attached to it. So I am gonna ask Sandy or Meg real quick, if someone gets the discount program through Ally, will those costs still be applied towards their Blue Cross Blue Shield plan?
No, they will not. So really the GoodRx
And if so, then you can use Nonstop for it. So I just want to make that clarification here. On discount programs, you just want to make sure they're covered by your plan before you use them.
Yeah, so they are not, Kathleen, they're not
Okay.
subject to the deductible.
Gotcha. Okay.
Yeah, you have me on mute, sorry.
Okay, perfect. So again, if you're offered a discount, oh, sorry, go ahead. Sorry.
No, I was gonna say, if they have the plan, they have a choice between 2 plans, one with Nonstop and one without. if you're using the plan without nonstop, and you could use the discount program there, but then the drug will not go towards your deductible. So just be aware.
Got it.
Okay.
Perfect, great. So if you are on the plan with Nonstop Health, make sure to skip discount programs when they're offered. Just use your Nonstop Visa card to pay for that. Yeah. All right, next slide, please. So I mentioned earlier our golden rules. Everything has to be covered. Everything has to be in network. And here's why. As I mentioned at the beginning, we are a MERP, Medical Expense Reimbursement Program, which is the type, it's a program that's dictated by the IRS. So we are bound by both the IRS guidelines for a MERP and our contract with your employer, right? We're bound by both of those things to follow those rules to make sure everything qualifies for the program. Our process for doing this is called substantiation. Substantiation just means that we're verifying that a charge on someone's Visa card did qualify for our program, right? It qualified for the MERP and it's in network and covered. We do not substantiate every charge on someone's Visa card, only the ones that pop up in our system as looking like we just don't know or we just can't tell. So next slide, please. What's gonna happen is this. If we flag a charge on your card, and again, that's a big if, that's not gonna happen all the time. But if we flag a charge on your Nonstop Visa card that looks like it may not qualify, we're gonna reach out to you via email 3 times over the course of several weeks. So if you missed the first one, don't worry, you're gonna get a second and a third from us. And we're gonna say in that email, we have a question about a charge and this amount on this date at this provider. And can you please send us an explanation of benefits if it was for a medical service, or a pharmacy bag receipt, or a printout from your pharmacist if it's for a prescription. Those documents will tell us immediately if something was or was not covered under your medical plan. So we're able to conduct a review and immediately determine if that charge qualified or not. If that charge, if we find that it does not qualify, we are gonna ask you to pay that money back into the account with Nonstop, right? So you do have to pay that money back. So just keep that in mind. That's why it's so important to do that due diligence first, make sure everything is covered and in network, so that even if we reach out about a charge, you can feel confident that you're not gonna have to pay that money back. Now, here's what I wanna let you know. We get asked a lot, can you please just go get these documents for me? Like, I don't have time. And listen, we would love that so much. We would love nothing better than to take this off of your plate. But we are not affiliated with Blue Cross Blue Shield. We're a separate program. And because of that, and because of HIPAA and privacy laws, we're not allowed to go muck around in your healthcare business without your permission, right? So we can't go talk to Blue Cross Blue Shield on your behalf because of those wonderful HIPAA and privacy laws. So that's why we do ask for you to go get these documents for us. Okay, next slide, please. Now, once we get that documentation, we're gonna conduct a review. And again, if we determine the charge doesn't qualify, you have to pay that money back. Now, let's say we never hear back from you. So we send emails and we don't hear back, or you owe a repayment and we don't hear back. We will suspend your Visa card at that point. I wanna be really clear though, that's not meant to be punitive, even though it might feel that way. Really what we're trying to do is stop and try and get in touch with you to resolve this one issue so that you don't keep mistakenly spending money on the Visa card you have to pay back. So it's really a protection in place for you if we have to suspend the card. So this is what I want you to know. If you get an email from us, please call or email us back right away. We are so nice. We are not scary people. We really want to help you. And so if you get an email from us, just call or email us back right away, and we'll walk you through exactly what we need from you and help you through this process. Next slide, please. This is just an example of what an email might look like from us. So it's going to come from nsetickets@nonstophealth.com, and you'll see it says Nonstop Visa card charge flagged for substantiation. If you get an email like this from us, it's not spam. Definitely email us back or call us right away, and we'll explain what needs to happen. Okay, next slide, please. The next one is about our portal. So we do have a member portal in place for you at members.nonstophealth.com. When you first go to that URL, you can click on Don't Remember My Password. We'll send you a link to set a personal private password. On the portal, you can check your balance. You can file claims. Let's say you don't have your Visa card and you paid for something out of pocket and want to get reimbursed. You can do that right here. You can see a history of open tickets with us, a history of transactions, lots of good self-serve help information on there. So I do recommend you check out the portal when you guys start out the program. Okay, next slide, please. Just some key dates to know. Your plan year runs with Blue Cross Blue Shield from January 1st through December 31st. That means your deductible and out-of-pocket maximum reset every January 1. And also along with that, your nonstop Visa card will also reset every January 1st. So you'll keep your Visa card each year, year over year. And at the end of each year, if there's any money left on the card, that goes right back into HCA's account with us. And on the first of the year, we reload that same card with all new funds for your new plan year. So that's how that's going to work each year. Now, let's say throughout 2025, you pay for some things out of pocket and you want to get reimbursed for them. Just keep in mind that all claims are due 90 days after your plan year. So for you all, any 2025 claims will be due to us by March 31st, 2026 for reimbursement or provider payment. Claims only happen if you don't need to use if you cannot use your Visa card for some reason. You don't have it or it's declining for some reason or something like that. So just keep that in mind. The last thing I'll note on this slide that you don't have to remember right now, but I will just give a plug for is because the card gets reloaded every year, once the calendar rolls over to the new year, claim from the previous year, you're going to send that to us via our claims process and we'll pay it on your behalf. We don't want you using the Visa card in the new year to pay for last year's services, but we'll explain more about that next year when we get to that for you all. So, okay, last slide coming up for me. I've talked a lot about the program. Oh, yeah. Yes. Are we running out of time?
No, we have a question from someone.
What if you don't use your, all of your, or some of your plan, and then is there a rollover or does it go right back to?
There's no rollover,
Okay.
so the plan itself is going to cover you for your out-of-pocket maximum in 2025. So if you spend $1,000, it's gonna cover $1,000. If you spend $6,000, it's gonna cover $6,000. And then next year it'll reset, like we might do a totally different plan next year that might have a higher or a lower out-of-pocket. It'll have replenished with new funds next year. It does not roll over.
It's not like the money that we put aside like that for the flex plan. This is not costing us anything.
Yeah. Any other questions? I'm on I went to the next slide.
Yeah, perfect. This is my last slide for you all. So I do just want to let you know, we went through the logistics of how Nonstop works. So now let me just wrap with why this is such an amazing program for you all. So the first and biggest benefit to you all is that Nonstop Visa card. So HCA has funded that Visa card for you to ensure that you stay as healthy as possible throughout the year. So with this card, they're giving you the opportunity to take full control of your healthcare without any worry about how you're going to pay for a doctor's appointment, medications, pregnancy-related needs, surgeries, anything like that. Nonstop, our mission is that we believe healthcare should be affordable and accessible, and no one should ever have to choose between their health, physical health, and their financial health. So we're really aligned with HCA on that, and that is why they are funding these Visa cards for you. So that's that Visa card is coming in to help cover all of those expenses around your deductible and your out-of-pocket maximum. So as I mentioned earlier, as long as you follow our golden rules, in-network and covered expenses only, when you go to pay for bills or prescriptions, you're not pulling out your personal cards. You are pulling out your Nonstop Visa card to pay for all of that, and you should not have to pay a penny out of your own pocket for the year. This is a wonderful, wonderful gift because it also gives you that financial freedom to get care as soon as you need it without having to defer any critical issues due to the high cost of healthcare or concerns about how you're going to afford it. So now, as soon as something arises, you can go nip that in the bud as quickly as you can so that you can get better faster and get back to things that really matter to you. The last two things I'll just note of benefit is our member support team. we really know how valuable good member support can be. And so we strive to be the friendliest Suburtas that you can get. I promise we are so nice. And we have folks in every time zone. So no matter where you are, you can give us a call or email us and we're going to be able to help you. We also have education throughout the year. We offer educational webinars. We come to your open enrollment meetings. We have monthly newsletters. I really encourage you to tap into all of our educational support so that you really learn how to use the program and feel super confident with it. I want to be clear that your comfort and success with this program is our #1 priority, and we want to be here to help you with that. So with that said, I'll go to my very last slide, which is just our phone number and our email. If you have any questions or you need any help or you want a refresher on this or anything.
Might have lost her.
All right.
Oh, there she is. She's back. Hello?
Program, you are going to get a series of welcome emails from us that will explain the program even more to you. If you do not get those emails in the first couple of weeks, please call us or email us so we can make sure we have your correct email on file. Okay, that's it for me. Any questions or anything that I can help with now?
Before, because I was gonna go over dental vision, life, all that stuff, but I want to make sure you get your questions answered while we have Kathleen on the phone. Any questions on how the program works, or is it clear? Everybody's nodding their head.
They'll
They're all
be
gonna
here
give me
extra, 'cause I know we have
100%.
only 7 minutes, only like 7 or 8 minutes, because people need to leave, so the next group can
Yep.
switch
I'm
up,
gonna
so,
go real quick.
but
on
they'll
the
be
rest
here
of
for
it.
other questions.
Yep. All right. So if you take I'm gonna go really fast. If you take the plan that does not have nonstop, you're eligible to open a health savings account. So there's about $100 difference in payroll deduction between the two. You could take that $100 that you're saving and put it into a health savings account. It's pre-tax, so you don't have to pay taxes on the money that goes into a health savings account. It goes in tax-free, it grows tax-free, it comes out tax-free, as long as you're using it for medical expenses. It is an account that rolls over. If you don't use the money in the account, it rolls into the following year. You can use it for expenses like your deductible, any co-insurance, any co-pays, any dental expenses, any vision expenses. But what I really look at a health savings account for is it's an account that allows you to save for future healthcare expenses. So you're putting money aside, so if you don't take the plan that has 100% coverage, you have money in the account to cover you if you do have something come up throughout the year, and you're getting the tax advantage on that. You can contribute up to $4,300 a year if you're single, and up to $8,550 if you're in a family plan. If you're over the age of 55, you can put an additional $1,000 into the plan. You don't want to put too much into a health savings account because you will get charged a 6% excise tax. So just be aware that you have that option. You have to be enrolled in a high deductible health plan where you're responsible for the deductible. So if you take the plan with a nonstop MERP, you cannot take a health savings account. If you're covering dependent children, they have to be full-time students or be 19 years old, so it's not dependent to 26 like other plans are. If you take the funds out of a health savings account for something other than a medical expense, you get a 20% penalty plus you pay taxes because it's just like a 401k.
Repeat that.
If you take the money out of a health savings account and you're using it for something other than a medical expense, you get a 20% penalty. Unless you're over the age of 65, then you can take it out without penalty. Okay. So you also can do a flexible spending account. Also allows you to set aside money pre-tax for unreimbursed medical expenses. You can use it to pay for things like your co-pays, your co-insurance deductibles, dental vision expenses. Also, over-the-counter medications you can use to pay for with a flexible spending account. If you don't take the plan that has the HSA, you can put money into a flexible spending account and get that pre-tax deduction. You don't want to put too much in because it does have a use it or lose it. I don't know how I'm going to get through this. It doesn't. You don't want to put too much in because of the use it or lose it rule, but you can roll over up to $660 a year. You can also do dependent account as well. That is for kids in daycare. I'm going quick here. New York State has Child Help Plus. Most of you are probably aware of this. Child Help Plus is a program that you can put your children on to help you save money so that you could just take either single or husband-wife coverage here, or wife-husband coverage, however we want to say it. You can, if you put your kids on Child Help Plus, it's a lower cost health insurance program for kids through New York State. We did put the chart in here. It's based on income and household size, so just so you're aware of it. And then the company offers you dental insurance, no changes to the dental plan. It's still the same. You still have the choice between the two different plans. The biggest thing to remember is the plan that's a little bit, that looks like it's not as good, which is the one that covers your services at $180.50. You want to take that plan if you see an out-of-network dentist. If you see an in-network dentist, you take that first plan that covers your services at a higher percentage.
And this year we did call them in-network and out-of-network.
Okay.
Just so you know.
Good.
So if you're not better dentist than the Guardian Network, that
You do have rollover. Guardian will roll over and add to your annual maximum as long as you go to the dentist at least once and use some services. You can get additional monies added on to your annual maximum. No changes to the vision plan. This I do want to mention, short-term disability. I mentioned in the beginning, long-term disability. I'll tell you guys, when I asked what your most valuable asset was, the answer I got was their behind. It was their most valuable asset. Their butt was their most valuable asset, is what one of your colleagues said to me about, this had to be about 15 years ago. It made me stop asking the question. So my answer was, well, if you use your butt to earn a living, then it is your most valuable asset, because your most valuable asset is your ability to earn an income. You have the option to buy up, and this is a new offering, so there's no medical questions. Your New York State disability only covers you for $170 a week. This allows you to buy up to an additional $500 a week. So you should definitely take a look at this when you go through open enrollment. And then the other big thing with the life insurance, like I mentioned, the company provides you with life insurance, but you can also buy up. You can buy up to $200,000 without providing medical evidence of insurability. Yeah. So the other thing that the life insurance is going to do is you can buy either $10,000 or $20,000 at open enrollment without medical questions. But if you want more than that, this first time you can buy up to $200,000. In the future, you'll be limited to that $10,000 or $20,000 without medical questions. So if you think you want life insurance, this is a good option. It's a discounted rate. You're bought because it's being bought in bulk. It's payroll deducted, so you don't have to remember to pay a bill. So it's a nice, easy, convenient, without having to give blood, urine, your firstborn. You can get life insurance without, even if you're not in good health. So that's like your biggest advantage there. Then you also have, these are AFLAC type plans to take a look at. It's accident insurance, hospital indemnity insurance, critical illness. These plans are designed to pay you if you have an accident, you're diagnosed with a critical illness, or you're admitted into the hospital. It's not going to pay the doctor, physician, hospital. It's going to pay you directly to pay for your everyday household expenses. You have the choice between accident, critical illness, and hospital indemnity. The way accident works is you have an accident. If you go to the hospital, if you go see a doctor, if you go for physical therapy, if you break an arm, you break a leg, they pay you. That's basically how these type programs work. I'm going really fast, guys. I'm really sorry. The specified disease is going to pay you if you're diagnosed with cancer, you have a heart attack, stroke, organ failure. You'll get paid a lump sum benefit. You can also buy into this for a spouse or a child. And then the hospital indemnity is going to pay out if you're actually admitted in the hospital. So if you know next year you're going in the hospital because you have to have surgery, you can buy into this and get that hospital indemnity benefit. And it's very inexpensive. You're up.
I'll go through this quickly. As I said, everybody has to enroll if you are in a benefit plan. Everything is on UKG. So we were gonna pull that up, but when you log into UKG, there is a tab at the top called Open Enrollment. If you click on that tab, you're going to see this benefit guide you can click on and look at so you can go through it. There's also all the links to Excelis, to Guardian, to Nonstop Health. You wanna find out if your doctor's in network or out of network, click on the Excelis link, put in your doctor's name, you can find out. Same with the dental, okay? And then there's gonna be a place where it says start your open enrollment. You click on that and you walk through. I will tell you, you have to go through each page, each step. So on the right-hand side, there's a continue button. It will not turn blue to continue until you have made the option on that particular page. If you wanna waive your benefits, on the top of the left-hand side, there's a little decline waive. Just click on that and keep going through. When you get to the end, you need to save and submit. And when you go to submit, you need to put in your UKG password. That's like electronically signing the package. Okay, I know that's quick. I know we're up against time. Brian and I will be here though, and we can kind of show you that if you want to see it on UKG. If you have any questions, obviously you can just give us a holler. Okay, I thank you for being attentive. Two more things. Number one, make sure that your email is up to date because that's how Nonstop Health can reach you. And make sure your address is up to date, because I think you all want to get your W-2s. So please make sure those are up to date on UKG. Thank you.
Oh, excuse me. I didn't know. I know.